Good morning. My name is Max Gross. I'm the editor-in-chief of Commercial Observer. I'd like to welcome you all to our first program of Commercial Observer's Tenant Talk series. I'd like to take a quick moment to thank our program association partner, CoreNet New York City, and event partner, Berdon LLP. Through its specialized expertise and a team of more than 100 CPAs and advisors, Berdon's real estate practice advises many of New York's as well as the country's prominent real estate entities and is one of the largest real estate practices in the nation. I would like to extend a special thank you to our host sponsor, Silverstein Properties. Many of you tuned in to hear Silverstein speak last month on why they'll never bet against New York. And the early steps they took in creating plans for safely returning tenants to their office portfolio. Now, just a day after the city begins its first phase of reopening, Silverstein Properties is joining us for a virtual exclusive on the new cutting-edge technology they're leveraging to help over 40,000 tenant employees plan their imminent return to the company's 13 million square feet of office space. Silverstein Properties doesn't just own and manage office buildings. The company is also a tenant in its own building at 7 World Trade Center. Leaders of the company will share with us for the first time the plans they have developed for their tenants and their own employees' return. Today, you will hear from Silverstein as they unveil their cutting-edge and multi-pronged technology suite. Dojo, a new office planning software, will make sure each employee sits at a safe distance at their own desks. Dojo was originally designed to use artificial intelligence to analyze how employees interact and communicate with each other and reconfigure office layouts to improve performance. Backtrack, a contact tracing software, will also be used to monitor employees' health. And Inspire, the company's hospitality app, contains real-time building updates, a CDC chatbot, and health information, an occupancy calendar, safe distancing seating plans, food delivery options, wellness activities, and antibody testing locations. In addition to the Silverstein team, we're joined by 2 tenants of the firm, Better.com and SOM, to hear firsthand how their teams are utilizing these new tech platforms. And I would now like to introduce today's panel. Our moderator today, Thea Kruger, a senior partner at Berdon LLP. Dino Fusco, chief operating officer at Silverstein Properties. Debra, senior vice president of human resources at Silverstein Properties. Kerret, president Silverstein. Arthur Matuszewski, vice president of talent at Better.com. And Julia Murphy, director at SOM. And with that, I will turn things over to Thea Kruger. Thank you all for joining us.
Okay, I think I'm unmuted now. Apologies for that. Thank you, Max. Good morning, everybody. Thank you for those introductions. I think I'd like to start with a question for Dino this morning. What is Silverstein doing in general to bring tenants back to work? I understand you're a portfolio of about 13 million square feet. So, how are you handling that?
Good morning, Tia. Thank you for the question. A little bit of context. I joined this call as a recently hired COO of Silverstein Properties before I joined Silverstein earlier this year. For 15 years, I was responsible for running the corporate real estate for a very large financial services company. So I had over 100 landlords for the over 100 offices that we had in 35 countries around the world. And so as a best-in-class developer, landlord, and employer, what Silverstein has really been focused on is making sure that every one of our employees, when they come back to work after the phase 2 has been lifted, are safe and healthy and productive in the workspace. And so that interest is very closely aligned with exactly what we want all of our other tenants to be. safe, healthy, closely aligned. So we're not only owners and managers and developers of our buildings, we are also tenants in our building. And so as we began preparing for the return of our employees, our EVP of operations, Bill DeCunto, has been at the firm for 33 years and a bit of a legend, if you will, in the building operations space. He and his whole entire team have really been focused on exactly your question. And so what I'd like to do is perhaps in picture form, show you what we've been doing to prepare all of our buildings for the arrival of all of our tenants and employees when they come back into the office. So rule number one, no one is going to be allowed into any one of our buildings without a face mask. And we'll continue to require all of our guests, employees, and tenants who do come into our buildings to continue to wear that face mask in all the public areas of the building. In addition, at every touch point in public areas, we have wrapped antimicrobial film around those touch points. You'll see that here on the revolving door, and all those touch points will be cleaned regularly all day long. Our building lobbies have very clear signage outlining important building rules and health and safety reminders for the building. And as you'll see in this next slide, we've installed plexiglass to protect the health of our receptionist, who's also required to wear face coverings during the entire time that they're working, even if they're behind those plexiglass shields in the lobby. Again, more signage and health reminders that will be there once you turn and walk through the lobby turnstile. And again, as this picture shows, even the turnstiles, because they're a high touch point area of the building, will have the antimicrobial film because it's a touch surface. And again, it will be regularly cleaned. We'll also have installed hand sanitized dispensers in all the building lobbies. And we will be monitoring people in the building lobbies and in the elevators to ensure that social distancing rules are being observed. Again, in this elevator cab, you'll see antimicrobial film on all the touch surfaces. You'll see a reminder that there's only to be 5 people in the building in order to observe social distancing. And we've put those 5 spots where those individuals will be standing during their elevator ride in the building. Masks on, as I said, at all times, because that's a requirement in the building. As I've also mentioned, we will regularly be cleaning all the touch surfaces throughout the day. The workers will be wearing PPE protection once the people start returning to the building en masse after the phase 2 has been incorporated. By the way, we're enforcing all of these same protocols in our back of the house spaces. So here's a loading dock area. You'll see that the loading dock supervisor is protected with a plexiglass shield, and also everyone in that space is required to wear masks. And again, even in the freight elevators, we'll be enforcing the number of people that can be allowed in the elevator. And then importantly, because all our buildings have been consistently operational through the entire time that the pause has been in place, all of our MEP systems are completely up to date and in order. However, for further peace of mind for all of our employees and for all of our tenants, we've commissioned a third-party licensed professional engineer for every one of our buildings to perform a rigorous inspection of our HVAC systems and our protocols to certify that every one of our pieces of equipment and our processes are meeting or exceeding all of our ASHRAE requirements and notice MERV ratings on all the air handling units. And in fact, we're proud to say that we're exceeding all those levels, and in many cases have the same kind of air qualities that's found in most hospitals. And then lastly, from a logistics point of view, we're firming up our supply chain, and we're even offering our tenants the opportunity to order masks or PPE equipment through our supply chain, so they have the benefit of cost and relationships that we have. And we're also coordinating with our tenants to ensure that we have the right logistics in place to enable, for example, tenants who may have employees that are riding their bikes to work.
Great, thank you. So Debra, on the HR side, as head of HR for Silverstein, what are you doing with your team to get your employees ready to come back to work?
Sure, thank you. Good morning, everyone. I'm Debra Hudnell, and I am head of HR for Silverstein Properties. I've been with the company for about 39 years now, and I'll be responsible for bringing the employees back to a safe, healthy, and productive environment. So many may be wondering, what can they do to ensure that their employees feel the same way? So I'd like to take this time to share with you some of the protocols that we have instituted at Silverstein Properties for our teams and our workplace. First off, we will be allowing our employees to continue to work from home if possible and if necessary, including those employees who have compromised immune system or otherwise vulnerable to having a very severe reaction to the coronavirus. Also, employees who have housemates that may be in the healthcare profession, we will allow them to stay home as well. Our protocol for employees who are in contact with someone with coronavirus is that they stay home for 14 days in quarantine or otherwise be tested. We will be asking those employees who travel, whether it's for vacation or for work, that upon their return from their travel, that they quarantine for 14 days as well. As far as traveling to the office, we are going to permit our employees to stagger their arrival times in order to minimize the congestion, especially our colleagues who rely on mass transportation to get them to the office. We will be requiring that face masks be worn at all times in our office. The only time when we're allowing, the only time that we would allow employees to remove their masks is if they're at their desk or if they're in their personal office. But as soon as someone comes into their office or is within the 6 feet, they should actually put on their face mask. We will also facilitate our conference rooms with video call capabilities. And by doing this, we will ensure that employees who are working from home are not at a disadvantage and have access to the same tools that we have in their office. As you will see, I'm going back to the social distancing. We have cleared out our pantries and our kitchens, and we have removed the tables and the chairs from there. And we have removed excess chairs from our conference room as well. And we have placed them at least 6 feet apart. And again, this goes back to everyone can't fit in the conference room. So those people who may be at their desks will also have the capability of joining in on the video conference calls.
Okay, great. I guess, sorry, go on.
As Dino had mentioned with the antimicrobial, as you'll see, we have them on all of our door handles and all of our touch pads in the office. So this way they will be cleaned on a constant basis. We will provide disinfecting wipes and Purell dispensers throughout the office. And we will also consolidate lunch deliveries. This way, we can have one order and one delivery at one time.
Great, thanks, Debra. Just a note, we're getting some great questions in the Q&A. We're going to save those for a little later in the program because I think a lot of the questions may be addressed by some of the material the panelists have provided, but we'll definitely, save time to address those. I want to turn to Tal for a second. On the technology side, how is Silverstein leveraging all this technology you have to, manage things like property communications and, making tenants comfortable in their space?
Well, I hope you can hear me. Can you all hear? Good morning. Thank you. Thank you, Thea. I think the most exciting thing after we speak about safety here is a technology that we identified. We have a platform called Silvertech Ventures, which is an arm of Silverstein that looks and sees about 50 to 60 companies every month. Some of them are relevant, some of them are less, and we pick the best technologies that we find work with different platforms, companies, and can help our tenants and ourselves in coming to the workplace. One exciting technology that I think we wanted to discuss today is a platform called Dojo, which is like a training ground. I'm myself in martial arts for my background. If you don't train and you don't test yourself and improve all the time, you stay backwards, and it's all like trying to learn martial arts by looking at a video on YouTube. The platform of Dojo is basically an technology and a artificial intelligence that helps companies operate their business and their workplace better. And it's scientific, and it's designed and looking at how a company operates on a day-to-day basis. That platform first looks at the digital footprint of every company and allows that company to see how are the people interacting, how are they meeting, how are they communicating, who is communicating with whom. Of course, trying and managing to show that to the top management of who should be physically close to whom, or who should have the capacity to interact the most with someone else. And with that, then the platform would run and say, what is the optimal way to put people in the physical space? Who can work best from home? Who are the individual contributors or people who can interact from home? And who are the people who can then need to be in a closer teamwork and in groups to work with each other? It's not necessarily departments. We actually find that in most cases, it is not departments that need to be together, but rather teams and groups that work on specific projects or specific development of, if it's software, the development of the elements of the software. And you'll find product management, engineers, QA people sitting and working together. So here you see an example of a company where the platform shows you who should be next to whom. There is a group on the right side of your screen, a green group that most of these people can work from home comfortably. They actually do work from home, as long as the person that is, I'm not controlling the screen, but as long as Daniel is close to the group in light blue and to Valerie, then they can interact well, and that solves the problem. So Daniel needs to come to the office a couple of days a week to have the best interaction with the group that sits at home. You have another group on the bottom, the red group, that also can work from home comfortably. The other groups here are working much more efficiently when they're close to each other. You see the strength of the graphs, the strength of the communication, how often people communicate and need to communicate. And of course, I've heard many, many times, and I've seen questions even in the Q&A here that we will touch on later. People say, why would someone need to come to the office if they can work from home? There are some people that can work from home efficiently and they may enjoy it. Some people that have kids at home or the environment is not terrific and they need to come to the office. And many, many people that when they are coming to the office, if it's 4 days a week, 5 days a week, sometimes 2 days a week, they get much more collaboration and they can solve for problems. We've ran through studies with large tech companies where if they don't come to the office, everybody feels that they're very well contributing, but at the end, the product doesn't come together and the launch date keeps on slipping or the product is not perfect. It really depends on the company, on the needs, and on the individuals. So this platform first analyzes and uses data. Then it looks at the footprint. And here we're showing you in front of you Silverstein Properties. I'm very comfortable showing our own company. I wouldn't show a tenant or a company that uses the Dojo platform, but this is our floor plan, one of the floors we use. We have a few, and you'll see people sitting on the floor. You'll see the colors of the departments. You can zoom in and you can see every individual person. And then an element at Dojo would say, can we stagger those people to come at the beginning in different groups? One of the plans that we have is to come in 3 groups. By the way, a lot of this has been learned from other countries that are about 8 weeks ahead of the US. We're not inventing the wheel. We didn't invent Corona. Corona exists in the world, not thanks to the United States, I believe, but we have to address it. So here you see how they're groups A, B, and C. You see the name on the left. And if you'd like to see how team A, if we check here for the 6 feet need, you will see if there are any, oh, if we can zoom in, you'll see that there are 3 people that are sitting too close to each other, not in closed offices. And Ashley and Alicia and Bill are too close. And what do we do now? So we can either decide to reassign a seat for an existing employee, or move them to another location, or move them to another group, like to group B, to solve for that hazard or that 6 feet distance between them. There is another example here, and we can zoom in and reassign. When we started at Silverstein, there were dozens of, I would call it 6 feet hazards. And if we want to be safe, not only asking people to put a mask on, but also asking people to stay safe in their environment and come in a staggered way to the office, team A, B, and C. The platform gives and ranks the health of the office, and then every employee sees on their phone, like you can see here, the seat mapping and where are you sitting today, what is your schedule. So my schedule would be, these are the days I come to the office in June, 16th, 18th, 23rd, 25th. And it would tell me where other people that I work with are on the floor, so I can communicate with them and I can see their schedule and who is sitting where that day, so I can find them easily on the floor. So that's part of the elements here of the Dojo platform. It's all done scientifically with data-driven, running simulations and thousands of different options on a floor. Something that manually, I don't see how we could have done in a reasonable pace, especially when things keeps on changing. If I go back one step, and I've seen some good questions that came, some people say, I would love to stay at home. If the platform would show that they are very productive and they can work from home, terrific. Some people may have other concerns from a partner, a spouse, and they need to stay at home. The platform then optimizes on how they would work with other people and how the other people should be moved or placed on the floor to be more efficient. So here is the example of some people on our floor that will work from home. This is an actual true live data that you're seeing. It's running in real time. This is not a PowerPoint. This is our company. And the people in purple are working from home. They need to work from home. We don't want someone like sitting on the bottom right side of the screen, who is my father-in-law, Larry Silverstein, to be coming to the office when he's 89 years of age, marching towards 90. It's healthier for him to work from home, and he will be very productive. So you now capture that there are more seats available to use for the people who are coming to the office, who want to come to the office. So that's that state. It helps the HR team, it helps the CEOs, it helps the COOs and the managers of the company to plan efficiently the coming back to the workplace. Now, if we go and we look at what other people are doing, since we did not invent the coming back to the workplace, we did use and we are using this technology. What we understand is people will come in different capacity, 30%, then growing to 50%, then growing to 70%. One of our partners in the United States is the largest commercial real estate holder in China, and they keep on helping us understand what's going on over there. Obviously, it's very different and the culture is different, but still people wear a mask and they come to the office. At the beginning, it was 30% and grew to 50, 70. Today, they're at close to 100%, 95%. Some people have to stay at home for their own safety if they are above a certain age or have high risk. And they would like to stay at home, but most of the people, 90-some% of the people are already back to the workplace. And in order to do that, things have to shuffle and move around to be the most effective and most efficient. And that's what you see here. Now, another component of the platform that you didn't see is what happens if someone comes to the office and they report the next day, I think I have Corona, I have some symptoms I'm expecting. So we asked them first, quickly go and get checked. This is an example of what is called Backtrack, which is on the Dojo platform, where it's an actual case study from our company. This is on the 34th floor of 7 World Trade. We have another group working from that floor. And what you see in blue, in the color blue here, is a person that called us and said, I think I'm sick. I think I may have corona. I'm hearing the symptoms. I'm losing my sense of smell. I'm going to be tested, but it takes time. What do you do? The system immediately runs on the entire company and checks distance between employees, checks who spent time with whom in conference rooms, and obviously the ability or being infected by the corona is by time and who was the person next to you. So the longer you spend time with someone who has the corona, the more at risk you are. So you can see here people that are at higher risk. The color red would be the higher risk, people who spent a lot of time. For example, on the bottom, that's Yael, our head of technology, Yael Ehrman, and she spent a lot of time with that person. And then you have people that are in orange and people in red, and the people in green were not at high risk. And immediately we asked the people that were exposed, all the ones in orange and red, please stay at home, quarantine yourself, try and get tested. At the time that we did that, this was in March, they could not get easily tested, but it actually captured real cases of who was infected, which is amazing. For me, it's amazing. For me, it's terrific. And I think the fact that the Dojo team brought us to us and shared this with us and helped us is something that would have taken us a long, long time to do what is called the tracing and finding who could have been infected by corona because someone else brought it. And if you have companies with hundreds of employees, since the corona is not going away completely anytime soon, there is an expectation that someone may bring it with them, and you want to test quickly and quarantine it and make sure that nobody is infecting the rest of the company. I hope this was helpful. It was very quick, but I'm happy to answer any questions.
Thanks, Tom. I guess just before I move on, quick question that just came in. Somebody asked, how is the data collection conducted? I guess in terms of, who was physically where at what times?
So it's a great question. First, nothing is 100% because in the case of Dojo, there are different ways to measure. Companies that will have their own systems like cameras, it could use that. But in this case at Silverstein, we do not. And it collects digitally who is in meetings and with each other. We do not disclose to the people who they got infected from for privacy, but it would say you've been close to someone who reported that they may have corona. We ask you to stay at home for the next 10 or 14 days. It collects it digitally, and it finds that you've been in a meeting with someone for half an hour or an hour. And if you've been with 2 people that reported, that's obviously more people who report that they potentially have corona. And it sees that you've been in a meeting, you have it in your calendar, and therefore you've been close to them. Also physically, the platform knows where everybody sits. So it knows physically if you've been close, 6 feet, 8 feet, 10 feet. The distance affects the ability to be infected in an office space. And there are many studies, it's not just the 6 feet, but it measures who is sitting as close to whom. And then it gives, according to the time they spend in the office, it also connects to your turnstiles, because some people could be in a meeting, but they're doing via Zoom, just like we're doing it now. Then the system knows to remove them and say they're not infecting each other, because corona doesn't pass very quickly over Zoom, as we all know. But
thank God for that.
Okay, so I hope this answers the question.
Yeah, thank you so much. So let's hear from a couple of your tenants at this point, who, we have 2 on this panel. Let's start with Arthur. Arthur, Better.com has office space across a couple of Silverstein properties. So can you tell us a little bit about what you're doing to bring your workforce back to work? And are you going to be leveraging services like Dojo that Silverstein is offering?
Thanks, Thea. Yeah, I appreciate it. At a first principles level, Better.com is fundamentally about being there to support our customers in a first-class way. And we take that same desire for excellence in customer experience and apply it to employees. So in terms of bringing people back to the office, we're focused on doing it thoughtfully. We're prioritizing employee safety as well as employee productivity. And as long as those 2 things are true, we're going to leverage whatever technology and resources we can. We have partnered with Dojo in the past, and we'll continue to do so in figuring this out. One of the points that Tal had made that resonated is in a pre-technology world, we were doing all these things manually in the early days of Corona before we even went fully work from home. And the challenge for us in delivering an experience for our employees that's really first class is doing it with consistency, with communication, and with an eye towards preserving community. And so we're following a lot of similar guidelines to what Debra outlined in terms of in-office social distancing, in terms of utilizing A, B groups, in terms of redesigning our seating, redesigning our pantries and communal areas, and really rethinking what does it mean to collaborate in an environment where the risk of corona continues to persist. In terms of bringing employees back, we're staging our return. And so we're allowing folks to opt in, and we'll continue to hold the line that no employees who are not comfortable returning will be asked to return. So we're bringing our initial wave of employees back in optionally in July, and then we'll continue to add employees in September and beyond as our ability to manage the risk and manage the employee experience continues to improve. Ultimately, we're in the business of reducing the confusion that our employees are facing. And so whether that's confusion commuting to work and taking public transportation, whether that's confusion in the office around where they can or can't sit, or whether that's having access to resources to get tested, to temperature screen, to know what to do in the event that there is an infection. Ultimately, we're trying to plan for all the things that give people a sense of where am I, what do I do? We won't have all the answers, but tools and technologies like Dojo and Backtrack will help us at least get closer to those answers because ultimately we're all figuring this out. And we've taken the principle of respecting our employees' ability to make their own decisions while supporting them with transparency and data to make better decisions for themselves and their families.
Great, thank you so much for that. I was just shifting to another tenant. Julia, you have a very unique perspective here in that your firm actually designed 7 World Trade Center. You're also a tenant currently building out 2 floors of office space. Can you just talk a little bit about that experience and how COVID-19 has maybe changed your plans or changed your way of thinking?
Absolutely. It puts us in the unique sort of position of physician heal thyself as we move into our space and finish our space, which we were over the moon about before this happened, moving into a curtain wall building, floor to ceiling glass, views, light, some of the building systems that were planned for back, or that were built back in 2008 in terms of air quality at 7 World Trade Center. Those are all unique opportunities. And so we are actually, I think next weekend, we're moving our server over to 7 World Trade Center. So, we're really starting to put our footprint there. We had designed a beautifully bespoke open space, huge focus on minimal materials and focus on collaboration and sharing, openness. One thing that many of our clients have that we have not had is so much shared social spaces to share a meal, spaces to convene and meet very informally. So now we do ask ourselves, as designers and employers, have we done the right thing? And I think overwhelmingly, we think that yes, that coming together, working together, obviously safely, and having a landlord like Silverstein who has been so thoughtful on sort of the pragmatic and the operational aspects of how do we come together and have confidence and feel safe in our building, and the clear communication of what are those protocols are so important. But I think we also think from sort of a larger perspective that this work from home experiment has been invaluably educational to us. We've seen what we can do when we're untethered from our, specific assigned desk, right? Or maybe even feel like we're being evaluated for the time that we're putting in a specific space. And that was intentional in our design. But we're also really feeling the value of working together, of collaboration, and what it means to be face-to-face. I mean, I think Tal sort of spoke to this, that there are certain almost intangibles that we miss out on when we can't come together. I think, architecture as a profession has this long legacy of a studio, of an open space, dating back to the past century. So for now, we're not necessarily rethinking how we design our space, although we do know that we need to control for density in the ways that were described, and technology is a great way to do that. And we also know that we need to be really communicative about the procedures. And I think that Silverstein has done an amazing job of highlighting those and being really clear. And, of course, as tenants will roll those things over into our own space in terms of being really clear about, where do you wear a mask? What can I put in the refrigerator? How many people, can I have in this space? And so we'll be very gradual, we'll be very deliberate in that way. But I think some of the things that were thoughtful, intelligent design before COVID will continue to be such, in terms of, I think 7 World Trade Center has MERV 16 filtration. I'm sure Dino can tell me if I'm wrong. Those were thoughtful, good decisions that have always been thoughtful and good. And we think that some of those things are just kind of durable, good design, and will continue.
Great, thanks. Just as a quick follow-up, in the medium to long term, in a post-vaccine or maybe even a post-COVID world, what longer term effects do you think this period is going to have on buildings and office space and collaboration and things like that?
Right. Yeah. I mean, we've been thinking a lot about that in terms of, assuming we will rapidly get a vaccine for this pandemic, but understanding the way that we have developed and operate in the world, there will be more dangers. And we do need to be thoughtful about that. And I think a few of the things that we've been thinking about, one is that people will still need to come together. So we will need the pragmatic operational methodologies to deal with that, with technology, with PPE, which are all very helpful. But I think we've also seen the value of the local in our communities. Anyone who has been quarantined at home, and we've seen how important our grocery store is to us, our frontline workers. So cities, we think, will continue to be really important. Places where you can, I'm one of the, I think, luckiest people in the world. I live in Brooklyn and I ride my bike across the bridge, and I'm going to do that over to 7 World Trade Center and be able to park it in the newly expanded bike room. And that kind of ability to live in a place where I can get everything I need. Maybe I have options about the way that I use transportation and get sort of the resources that I need, that I can live close to where I work. We think those will be very durably important as we move on to the future. And then obviously, density is something that I think has been questioned during this time of pandemic disease, but it's also been one of the saving graces of our ability to help each other and support each other. So, we think that will be increasingly important in terms of the ability of a mixed use city. Obviously, the cities need to be healthy. We need access to open space. We need very healthy buildings that are very well maintained and managed. But I think that's sort of how we're thinking about the long-term trajectory. And then knowing that we have learned some things about work. Sometimes that's the elephant in the room, right? Well, we still need offices and shared collective spaces. And I think, ultimately the answer is yes. We need ways to come together as teams, especially as creative teams. There's so much we can do through technology, but we also do need a shared culture, a shared value system, and an ability to be together and work together.
Great, thank you. Throughout that, and I think I've heard each of you mention the word transportation at various points throughout your answer. And, in all these discussions, that's obviously a big topic of conversation. And unfortunately, maybe it's outside, the immediate scope of building owners and tenants. But, I'm curious what all of you are doing, but maybe Silverstein specifically, how are you handling the CDC guidelines on employees avoiding public transportation when they come to the office? So maybe Debra, I'll throw this to you, and anybody else, please, chime in with additional thoughts.
I'm happy to jump in if you can hear me. And if anybody else wants to jump in, please do. A couple of things. One, and your question has two steps. You asked about the CDC guidelines, and I don't know if someone can share it, but in the building app, which is offered to all of our tenants in all the buildings, this is called Inspire, there is a health component which we are asking every person, or the companies will ask every one of their employees if they choose so. It's connected to the CDC chatbot, and we have our own integration with the CDC chatbot that has been updated as of last Friday, so it's 4 days, and they keep on updating. And you get questions that the chatbot would ask you, you answer those at home, and the system tells you automatically, should you come to the office or report that you may have COVID or you need to be tested or stay at home. Also in the app, we give you all the locations and the closest location to be tested. It's covered by your medical health providers, and we give every person the ability to see where is the closest location to their home immediately so they can feel comfortable to be tested. All connected through the building app and what is called Inspire today. So that's one question. About commuting, we've been working with two companies. One of them is with Uber to allow for a pickup per company. So if there are X number of employees working on the, say, Upper East Side, and they would like to get to the building, they will have a driver pick them up with a mask, and everything is sterilized, and they will pick the same people that are going to sit in the office. They all should wear a mask, but it's not going to be random people in the car. So they need to agree on a time, and then it will pick them up through the app to help with that. We also provide, we negotiated for our buildings to get special rates if people need to come with their cars, so they can get, let's say, $15 a day or $20 a day, depends on the location, much cheaper than normal prices to park their cars. And we've seen something that is interesting in China and other locations that are a few weeks ahead of us, between 5 and 8 weeks, if you're looking at Hong Kong or Shanghai or different locations, that over there, most of the infection is actually not coming from the public transportation, as long as people feel comfortable and are wearing their masks. Of course, if you don't like to wear a mask, that's a different problem, but we do recommend people to be in the public transportation with a mask. And I do understand that some people will be concerned and say, I don't want to do that. So I would like to drive a bicycle, which is totally okay. We help with that as well in our buildings and store the bicycles now. We actually put a full program to help people feel comfortable coming back to the workplace. And this is mostly, I'm expecting to be in effect and in consideration and concern for the next maybe few weeks or couple of months until the cases of corona go down dramatically. But still, there may be people that change their life habits and say, I prefer to take a bicycle. I already heard about people willing to do that. And once they experience that, they feel comfortable riding the bike on the West Side Highway, getting to the building and parking their bike. And of course, we have buildings across all of New York and in other cities. Every location is very unique and very specific. So that's that question. I've seen questions that come again and again on the Q&A, which is great. Thank you for everybody for asking. So I'll just answer for one more point, which is relates to the health. If it's okay with you, Thea, they're asking about air filtration. And SOM, Julia is here from SOM. They helped us design, and we work on 7 World Trade. Also, they are the architects for 1 World Trade. We show the air quality on the building app, so you can see it in the morning. Where is the air quality? We have in 7 World Trade, for example, and the other World Trade Center buildings, filters called MERV 15 and up to MERV 16. I think the code is much lower. It's less than MERV 13. And every notch you go up becomes much more serious in terms of the air filtration. It's tested by third parties to make sure that we get that. You have to push the air, double the capacity of the normal buildings, and filter them through 3 different active filters. MERV 15 is what they use in hospitals. MERV 16 is what is used in surgery rooms. And we have that across our buildings at the World Trade. And in other buildings, we upgraded the air system and the filtration system because we want to be above what is required. What is required is good, and we want it to be more than that. Especially, we live in those environments and we love the tenants to be as healthy as possible. This does not prevent someone from contracting something with their kids or walking on the street, going to a restaurant, but it's doing the best it can. Now, by the way, when people ask, so how come, I've seen in the questions, how come this system is so quickly, the Dojo platform, at least I understand, was developed over years. It wasn't developed for COVID specifically, but it was adjusted in the last few months. But it was developed also to reduce any type of illness, from the flu to anything else in the office, as you want to capture as many people. The moment they know that they're sick, who did they come in touch with? Who were they close to? People ask, is this with RFIDs or other systems? No, it's looking at the digital footprint, which is a very close approximation to what people do physically, meaning your meeting schedules, where you sit physically in the office space. And there will be some cases where it would not capture, like if you're going to the bathroom. Be careful and put a mask on. But the system is not watching you. The system is all about privacy. We are not in countries that step on the privacy line, but it's doing it very, very well. And since we run it on ourselves and we eat our own dog food, or good food, not dog food, we feel very good about offering it for any one of our tenants, our existing tenants in our buildings.
Thank you. I guess, Dino, I'd like to ask you one more question before we, start posing some of these audience questions that we've been getting. Have you received requests from any tenants yet to either increase or decrease the size of their space, or do you think those requests are going to be coming in the short or medium term?
It's a good question, and look, the jury is out, but there's a lot of anecdotes, a lot of speculation that on one hand, fewer people may be coming to the office on any given day because many companies have realized that their employees can be productive. But as Julia's mentioned, as others have said, Arthur including, there's a lot more effectiveness, efficiency, collaboration, product development, quality work done when people do come to the office. So I guess one part is you may have fewer desks available because maybe some of your folks are working from home part of the time. A day a week would mean your portfolio could reduce in size by 20% in terms of number of seats. But on the other side, if you want to supply a little bit more distance between individuals so that they aren't as anxious sitting in close proximity to one another, that increase of 20% would leave you at pretty much the same footprint you are at right now. And that's why, as Tal's mentioned, some of these tools and efforts and products that can help you manage what you already have is a much more effective, much more efficient way to deal in the short term with what you're paying for on your current lease.
Great, thank you. So I think we have about 10 minutes left, and we're going to pose some of the questions that have been coming in from the audience. So yes, first of all, what are you going to require for those who unfortunately have contracted the virus? What's going to be required for them to come back to the office?
I'll take that. We're requiring that they bring in a doctor's note once they are cleared from having the virus.
Okay, thanks. I guess, and next, a question on this technology, and Tal or Dino or whoever wants to take this. Do you foresee the technology being provided in the future as a tenant service? And are you thinking about what lease language will need to be changed or required to allow this or facilitate this?
Let me take a first crack at it and then hand it off to my partner, Tal. I just want to emphasize what I started my presentation with, which is after having literally over 100 landlords coming to Silverstein, which is aspiring, I think doing a very good job being a best-in-class developer and landlord and employer, all the tools that we have used and developed, we've developed for ourselves, first and foremost, to make ourselves healthy, safe, productive, organized, efficient. And this pandemic perhaps has accelerated the interest of many of our other tenants in having access to these exact same products, tools, and apps. And so from now, as Tal has mentioned, we're making them available to our tenants. We want to demonstrate to them as a best-in-class landlord what they're getting when they come to a technologically state-of-the-art advanced landlord like ourselves. So to the extent that our tenants want access to these apps, we will make them available. Going forward, if there are certain products lines that are different than our standard offering, yes, we would include them in our leases as an addendum or a provision to the lease. If there are, parties outside of a Silverstein building which would like access to these, applications and tools, I think we would consider making those available as well. But Tal, over to you on anything I may have missed or you wanted to specifically address.
I think, Dino, you said it very well. And with Dino's background heading the global real estate for Goldman, I'm sure you've seen technologies out there and companies and landlords, as you mentioned, doing different things. But I believe that what is offered to our tenants, what we want to offer to our tenants, is always to get them the best technology and the best platforms to be the most productive and efficient that they can be. We cannot run their business. We don't want to run their businesses. We want to help them become the best leaders that they know and can be themselves. So we constantly bring and look for the best technologies that we tested on ourselves. If we are comfortable, we tell them, here, we are comfortable. In this case, we bought a license for all of our tenants as Silverstein because we saw how well it works on us. And we said, okay, it's great. Let's buy a license for our tenants. They can use it. They can decide not to use it. But it basically runs through, helped every company to optimize where they sit, how they sit, what is their graph of connectivity between people, what's the digital connectivity. And we found this to change the way we operate, to make us much more productive, to make our employees much more happy with how they work, where they work. And when you multiply that by the COVID issue, it changed our lives. And I think it's worth it for some tenants, of course, and those that needs this to use. I think to the question of do we need to change leases, where there is a room, maybe I don't see for a platform like this that you need to change a lease. You're offering it to the tenants, and if they like to use it, by all means, if you're willing to, as a landlord, to spend and to get it for your tenants, the tenants should be happy. And since we don't step on privacy, this is the companies running it on themselves. We do not look at their data. We don't need their data. It's for themselves. It's for how they operate. They know already who is meeting with whom through looking at Outlook or the G Suite Outlook, but they do it manually rather than doing it automatically. So this just gives them the ability to do things in a much more efficient way, using data, using analytics, and using AI to optimize on a space.
And just to follow on there, if I may, I think a lot of credit to Tal and Guy and Dino and the team. But I think for us, as a tenant, the most important element has not been getting answers to all of our questions, but getting information and education. So learning what's worked, learning what hasn't worked, learning the different approaches that have been tried. For us, we take our employee experience as seriously as we take our customer experience. And it's about finding partners that are willing to work with us, even for things like this public transportation question or questions around, what will the future state of work from home look like? I think the reality is all companies, all landlords are figuring it out. And for us, it's much more important to have the muscle to learn from mistakes and learn from successes and really be able to make what works best for us real for our employees. And so we're grateful for the support in figuring that out. And the more data and technology we can use to do that, we're confident that the quicker we'll get to a better place.
Great, thanks all. Just, has there been any talk about actually redesigning spaces, or for now, are you just sticking with, utilizing your existing configurations and incorporating social distancing and things like that? Do you foresee, maybe at some point in the near future, having to actually think about, redesigning and reconfiguring spaces.
Julia, that may be a good question for you. I presume you have a lot of clients that are grappling with that exact question.
Sure. Yeah. I think we look at this in, both the near term and the long term, right? So what do we do sort of pre-vaccine immediately? And I think we've seen, really solid examples of that. The adaptation of furniture to incorporate windscreens, things of that nature we're seeing, but we are also trying to think about the long term. And I saw an interesting question about elevatoring, and I think it will be a feedback loop in some ways as we understand what the work from home experiment has really unleashed in terms of flexibility. The question about elevatoring, that's a very classic pinch point. It's a very expensive part of a building. It eats up a lot of the floor plate. Are we going to double our number of elevators to serve the same number of gross square footage? Probably no. The interesting thing about elevatoring is that so much of it is psychological and about wait time. So, I think there'll be a feedback of how are people going to utilize the unleashing that has occurred from the work from home experiment, in terms of, I'm going to go to the office, maybe not, I'm not going to arrive at 9, I'm going to arrive at noon when I have a meeting because it's more efficient for me to work from home in the morning. We expect that some of those things will impact how we experience some of the rush, the pinch points of, for instance, I realize I'm talking about office towers, but I think we're also looking at things like outdoor space, operable windows. I think there's an increased interest in that, but it also sort of goes with the long-term ideas that I think those in the real estate industry have long been thinking about in terms of wellness, right? And it also gets to elevators. Are there more connecting stairs, right? How do we all become healthier in living in our buildings together, right? How can I live close to where I work or have an active lifestyle and use the outdoors perhaps in a way that, I think we've all seen in New York, every setback terrace is now, an occupied roof if it's possible. And I think things like that will become increasingly important, as well as well-managed communal spaces that tenants can use and depend on those being cleaned, to hold larger groups when the time comes that we are able to do that again.
Great, thank you. I think that's a pretty nice kind of optimistic note to end on. Just the last 30 seconds, Dino, get out your crystal ball. When do you think the majority of your tenants are looking to come back or will be back in the office?
Yeah, it's a good question. If you look at those cities, large international cities that are typically compared with New York, many of which Tal has mentioned are in Asia, it's now 8 to 10 weeks, and many of them are at 75 to 85% capacity. That being said, for the first 4 or 5 weeks of many of those cities, they were at 10 to 15 or 20% capacity. So I think there is a, putting your toe in the water, especially about mass transportation, that will really dictate whether there's a significant acceleration back to 85 to 90% or much slower and directed. So my crystal ball would be focused on the subway systems more than any other attribute about getting people back to work in New York City proper.
All right, thanks. So it sounds like in New York City, we're just at the very beginning of dipping that toe in the water. So I think it'll be very interesting to see what the coming weeks and months, have in store for us. So I think with that, we're out of time. Thank you to all the panelists for joining us today. I think it's been a great conversation. And looking forward to, see what's to come.
Thank you, Thea.
Thank you, Thea. Thank you, everyone. Thank you, Silverstein.
Thank you, everyone.
Bye-bye.
Bye.
Bye-bye.
Thank you all for tuning in today. I'm only disappointed that Tall didn't tell us more about his martial arts background. But thank you for tuning in today's Tenant Talks program, an exclusive unveiling of the Silverstein Properties technology suite for safely returning tenants to their office space. I would like to thank our host sponsor, Silverstein Properties, as well as Berdon LLP and association partner Kerret New York City. Don't forget to register for our upcoming Tenant Talks program, including the June 17th program with L&L's David Levinson and Robert Lapidus, as well as Norman Foster, and an exciting lineup of speakers to discuss New York's first well-certified building, well-certified office building, I should say. We also have a program scheduled for June 23rd with Leslie Himmel, Marianne Tai, Steve Purpura, and leading life science tenants to discuss how the high growth industry has become a critical component in rebuilding New York City. We hope to have you join us for both programs. And once more, thank you for joining us today. Take care.